Hodgkin's lymphoma. What you need to know in 60 seconds, let's dive in. Hodgkin's lymphoma is a malignant tumor of the lymphatic system, characterized by the presence of Reed-Sternberg cells. It typically presents with painless, rubbery lymphadenopathy, often in the neck or supraclavicular regions, and can involve the mediastinum, causing a visible mass on imaging. Key systemic symptoms, known as B symptoms, include fever, night sweats, and weight loss, and are associated with a poorer prognosis. Patients may also experience pruritus, lethargy, and even alcohol-induced pain at the lymph nodes. Diagnosis begins with an excisional lymph node biopsy, confirming Reed-Sternberg cells, and is supported by imaging like CXR and Peru time/central time scans. Staging follows the Ann Arbor system, from stage 1 localized disease to stage 4 disseminated involvement. Treatment revolves around the ABVD chemotherapy regimen, adriamycin, bleomycin, vinblastine, and dacarbazine, sometimes combined with radiotherapy for localized disease. Hodgkin's lymphoma is highly treatable, with excellent outcomes in early stages. And that's your 60-second crash course. For full lectures and more high-yield content, subscribe to MaxMed Academy, your ultimate study partner.